neoplasm simply means is tumor. Tumor. It is very, funny how most people, especially Nigerians, react once you tell them they have a tumor. Most Nigerians believe once you use the word tumor, it's an indirect term for cancer. So in today's class, we are going to clarify this term so that we get to understand what tumors are, how we differentiate them, so that you don't get scared whenever you hear the word tumor. Now, let's go further immediately without wasting time. What is a tumor? A tumor, or if you prefer to use the medical term, neoplasm, is just a simple word that we use to describe a mass of abnormal cells that are formed inside your body. They are a mass, just a mass of abnormal cells. You remember how we normally talk about how our bodies sometimes, especially when we are dealing with a subject like immunology. In most of my classes, I've always pinpointed that in most of these abnormal cells, they were once normal. If you look at the word abnormal, it means something that was once normal that is no longer normal. It's now behaving abnormally. So all these abnormal cells were once normal cells. All of a sudden, for several reasons which we are going to see later in the course of today's lecture, they now became abnormal. And when they become abnormal, they begin to grow. And when they grow, you now find this mass of abnormal cells, and we refer to them as tumors. They can affect tissues, they can affect glands, and they can as well affect organs. Now, they can vary in size. Some tumors can be big, while some tumors can be small. So, and one interesting thing is that not all tumors are cancerous. That's one thing we want you to take away from today's class. Not all tumors or neoplasm are cancerous. You may even hear words like neoplasia. It's just the process of cells becoming abnormal. That process. So you hear words like neoplasia, we're all referring to the same issue of tumor. Now, let us quickly jump into something that will help us in today's class. How do we know the different types of tumors? How do we know the different types of tumors? Let's start with the first one. Hello? Can you hear me? Hello?
We can hear you.
Yes, continue, sir. Continue, sir.
It's okay. Thank you very much. Now, let's start with the first type of tumor. We refer to it as malignant or cancerous tumors. Malignant or cancerous tumors. Now, please look at the diagram in front of you. Look at the diagram in front of you. Tumors, when I define it, I said there are mass of abnormal cells that grow inside your body. They were once normal. For several reasons, which we'll see later, they became abnormal. Now, for malignant or cancerous tumors, one thing that makes them different is that when they are formed, they grow and they move out from where they grew and begin to invade other cells, other tissues, other glands, and other organs. So they do not stay in one place. That is how we get to know them. They spread into nearby tissues and organs. And these new tumors that spread, medically, we refer to them as metastasis or METs. Metastasis or METs when they spread out. And you know, one interesting thing is that most times, even when you try to take them out of the body, you find them growing somewhere else again. A good example, you find maybe a woman with a malignant tumor in the breast, and probably one breast is taken out. After a while, you find the other breast that was initially not showing signs of malignant tumors now having it and invading that particular breast. So they have this stubborn attitude of even when you try to take them out, they still come back one way or the other. So that is how you get to know them. Now, how do we differentiate a malignant tumor or cancerous tumor from a benign tumor, a benign or non-cancerous tumor? Now, please, again, look at the diagram in front of you. The one to your right is the one I have just explained, malignant tumor or cancerous tumor. Now, look at those malignant cells. Look at those malignant cells. Now, look at the normal cells. The diagram to your right. There are two diagrams in front of you. The one facing your right leg. Look at that one. You can see how these malignant cells or cancerous cells are leaving the site where they started and they are invading other tissues, other organs. You can see them moving out, going to attack. Now, for benign cells, for benign non-cancerous cells, once they are formed, they remain within the enclosure of where they are formed. They are not invasive. They do not spread out. That is how we differentiate benign tumors or benign or non-cancerous tumors from the cancerous tumors. Now, it is the medical personnel that can determine this and not you. That is why we often advise that once you feel signs of a tumor, the best thing you do is consult your health practitioner, consult your physician. We are so grateful in Superlife that we have somebody like Dr. Chooks. I don't know how you people appreciate this man. He is a gift to this company. For me, I don't joke with him. We are colleagues, but notwithstanding, I still don't joke with him. Recently, just yesterday, I had to consult with him as soon as a sonographic report was sent for fibroids. As soon as I got that result, looked at it, I had to send it to him for him to look at. The medical profession is not a one-man's job. Nobody is an island as far as the medical profession is concerned. There are areas he's more of a professional than I am. And there are places he will ask me, that is how we work. So there's division of labor in the medical profession. And he gave me an answer, and we took the answer to the patient. And to God be the glory, the country director had already explained it when he was telling all of us how we enjoyed ourselves in our different outings last week and this week. So now we know benign non-cancerous tumor. So let's go further and see others. Now, let's look at another one, the third one, which we refer to as precancerous tumors. Precancerous tumors. Now, for you to understand this, we're going to look at it from different angles, using the diagram in front of you. If you look at the first one, cell with mutation. Now, you can develop a tumor from mutation. A lot of people take, for instance, the period during the Second World War, when the Americans dropped the atomic bomb in Hiroshima and Nagasaki in Japan. Those two sites are historic sites. After the dropping of those two bombs, a lot of things happened and are still happening. A lot of people that were affected by the radiation that came out from that atomic blast mutated so many cells, and a lot of people started having cells that became mutated. When a cell mutation takes place, you now find that cell that was heated to normal becoming abnormal. So mutation is one factor that can make a cell become abnormal. So let's look at a cell that is mutating. Now, it graduates to what we refer to as hyperplasia. Hyperplasia means cells that are dividing rapidly. So if you look at the diagram in front of you, it started with just one cell that is undergoing mutation. Then all of a sudden, it has started replicating, dividing rapidly. Now, you now find it migrating faster, where the division becomes a lot faster. So here we are looking at dysplasia. And once this occurs, then we have a condition that will generally, for we in the medical world, we say if something is not done, we are looking at an early stage cancer development. And it moves to what we refer to as in situ cancer. And in situ cancer refers to a group of abnormal cells that have not spread from their original location. So that means you have this, what we refer to as stage 0 or stage O cancer, where it has not left its original location. So we refer to this as in situ cancer. So, but this gives us one single feeling that if something is not done, this non-invasive cancer will change and become invasive to where it begins to spread. So the diagram in front of you clearly explains these 4 stages of precancerous tumors before they become cancerous. The first 3, the first 3. So here we're talking about precancerous tumors, cell mutation, dysplasia, hyperplasia, dysplasia, and in situ cancer. So this alone explains our precancerous tumors. Now, there are times patients confuse tumors with cysts. When they see a cyst, they get scared. They say, this is a cancerous tumor. Cyst is not all cysts that develops into cancer. In fact, majority of them don't. Now, most cysts, when you look at them, how you differentiate them from tumors is that they contain fluids. They contain fluids inside of them. This you find this sac that has a lot of fluid. Some it's air, some is other tissues that have gone in. So you see this bulge, and you begin to get scared when it bulge out of your skin, for instance, and you say, hope this is not a tumor growth. No. Tumor, they are more solid in nature. The tissues that have been invaded are already, they look solid compared to cysts that have more fluid. Now, if you look at the two diagrams in front of you, it enables you to understand what we mean. But let me give you a second diagram so that you'll be able to understand it a lot better between cyst and tumor. Now, let's look at the second diagram here. You can see a tumor. If you look at this young lady's jaw, you can see how cancerous cells can migrate. You can see a malignant tumor here. You can see how the cancer cells have migrated to other tissues, leading to this big bulge. But if you look at the cyst in front of you, you can see a clear, even though there's a swelling, you can see clearly, even from a layman's eye, that it has fluid inside. It has fluids inside. So it enables us to understand it. So when you see a cyst, don't get scared. Don't begin to cry to high heavens that, cancer has developed. No. You take it to your medical professionals. They'll be able to look at it and tell you to relax. It's not something you should worry yourself about. The medical doctors can handle it. Now, if you look at the problem of tumor or cancer generally, it is becoming alarming. You know, the population in Asia tends to be large. If you look at global population, the Asians tend to have more. China alone, you can talk of billions of people, let alone if you're adding Japan, Malaysia, Indonesia, India. India, that's even second, with almost 800 million people in terms of population. You can imagine putting, so Asia has the largest 60% of the global population. And because they have the largest, the number of cancer cases in Asia is high, 9.7 million. 9.7 million with 56% of deaths. That's we're looking at around 5.4 million, only in Asia alone. Now, Europe is second with the largest cancer burden with 4 million new cases, followed by North America. Thank God in this one, Africa tends to take the rear. But that does not mean it's a celebration for us. Africans are beginning to imbibe Western cultures. And because we have left our natural products, we've left what God gave to us, our herbs, our plant cells, we are being punished today. I remember telling the country's director in one of our trips that when you go to the graveyard, you find so many medicinal plants and people don't ask why. Go to our local graveyards, you find so many herbs. Why are there so many herbs in our graveyards? The answer is simple. Those herbs are angry with the people that died. Some of them, or most of them, died from ailments that the herbs was just in their backyard. And in anger, when they died, the herbs grew on top of their graves. So that is food for thought for all of us. In Nigeria, we are beginning to record over 100,000 new cases of cancer every year, going by the WHO report. Fatality ratios is becoming very high. So we cannot sit back and cross our legs and say it does not concern. It will only not concern you if you are taking Superlife, you are taking herbal products. You can protect yourself. You can equally protect others. That's why I started this business of going out with the country director, going out, contacting Dr. Chus, going out with Chris Sampson and so many other Superlife teams, so that we can take this out, not just my lecture every Friday. Now I am on the street, preaching the gospel of Superlife to the people, the gospel of health. I made somebody laugh that very soon we'll be having a convention for Superlife, and the person laughed. I say it will happen. Let's look at the symptoms and causes. Some of the signs or symptoms, those with these tumors, will have is one, fatigue, fever or chills, night sweats, loss of appetite, and unexplained weight loss. Now, the lump might be painful in some cases, while in some cases it might not be painful. But since you may not know what it is, please, we will kindly advise that once you see a growth that you do not understand, please see a medical consultant. Now, I've told you that some are malignant, some are benign, so while some are in their pre-stages. A lot of factors can bring this to bear. Don't forget, I talked about gene mutation, using the case of the Hiroshima and Nagasaki cases in Japan that ended the Second World War. I've equally talked about there are some inherited conditions that can predispose you to tumor growth, the Lynch syndrome as well as NFS, that's a neurofibromatosis. I know Dr. Chooks is listening, maybe he might throw more light on this. This is his stuff. Then a family history of breast cancer. If the family has this long history of breast cancer as well as prostate cancer, then that means those who are born into such families stand a risk too of getting this condition. That's why as adults, please, there will be need for you to constantly go check your PSA. Don't just sit down one place and say that, no, I don't have prostate cancer as a man. Please go check whether your PSA is within the normal range. I want to plead with you. A lot of us just sit, we don't know our PSA. Once you are 30 and above and you are listening to me, please check. Just keep on checking. You enter 40, check. You enter 50, check. If you enter 60, check, because the range for this age bracket varies from, it's not the same value for if you're between 30 to 40 or from 41 to 50 or 51 to 60, their values are different. So by the time you speak with the medical lab scientist, you'll see the normal range for your age. So please, if you're listening to me and you've not done your PSA, I would strongly advise that you get it done. Now, I've always advised on our programs that if you're smoking, you better stop it. You're exposing yourself to a series of dangers. Then if you're exposed to secondary or secondhand smoke, where you're always hanging around people that smoke, you don't smoke yourself, but you hang around people that smoke, you are equally endangering yourself. I've equally talked about too much consumption of alcohol. Please, if you cannot stop it, limit it. Alcohol consumption will not take you to heaven. Oh, please, that's my take. People vary, but that's my own. Whatever might be your opinion is your opinion, but this is my own opinion. So, since it cannot help you on earth, then why continue to take it when you know it will not even help you after this life? So why not stop it? Stop alcohol. It does not help. Then please do not expose yourself to toxins. Do not expose yourself to radiations. Even when you go for x-rays, don't have this constant habit, everything x-ray, x-ray. You want to do x-ray, x-ray. Please, constant exposure to x-rays will not help you. Then the human papilloma virus is another thing that we must do our best not to have. That's genital wart. We've lectured on this. So in case you missed the lecture on HPV, please feel free, it is there online for us to go back to. Then if you know you're obese, we've call it done a good lecture on obesity, and please, you can go back and follow up on our lectures. So in a nutshell, these are some of the risk factors, the conditions that can predispose you to tumors. Now, there are so many complications that can arise, but at this stage, I don't know if Dr. Chooks is with us. I want him to take it on from here where he can explain to us on diagnosis and some of the tests that can be done. If he's not around, then from Chilaka, if he's connected, can equally handle this. At this stage, I want to thank all of you for listening. It's my pleasure coming to you again this week, having missed last week.
Both from Chilaka and Dr. Chis, none of them are here.
Okay, I've just been informed that Dr. Chut is not connected. The same thing with from Chilaka. Now, please, once you find a tumor and you don't understand what you're feeling or touching, we'll strongly advise that you see your healthcare provider. Please go see your doctor. If it is a cancerous tumor, they might want to do a biopsy. And the biopsy is just simply taking some cells from those mass of abnormal cells to now go do a diagnostic check. Most times it is a pathologist that examines these samples in the lab and comes out with his report. In some other cases, a blood test will have to be done in order to look for tumor markers. These are specific proteins or chemicals that are often used to check for malignant tumors. Then in other cases, you might be required to do a scan, an X-ray, that's a CT scan, an X-ray, or an MRI. Or they might request in an advanced setting for you to do a positron emission tomography, which is a PET scan. And any of these will be able to identify the presence of a malignant tumor, or whether it is a benign tumor, or whether it's still in its pre-cancerous stage, just like we have observed in the first 3 stages that we looked at, the 3 types. So at least today's class has enabled us to know the different types and the action we can take and what can predispose us to getting these tumors. That's why I'm strongly against all of those things that we humans imbibe in that exposes us to dangers. There are ways you can manage this condition. Now, the best management is prevention. Prevention is better than cure. Whether it is benign or malignant, we don't want it. Whether it's pre, we don't want. It should not even start in the first place. Autoimmunity must not occur in our body, where cells for no reasons begin to behave abnormally. So we must not have it. Then if, for instance, you are not sure, that is why the Superlife products are here to help us. And in fact, I feel pain when I see a lot of us not taking this product. I will strongly advise, please if you can't get all the parts, keep one pack in your house where you take it. You take it at least once in a while. It will really help. It will really help. And God will help us both in our health and in our business. At this point, please permit me to call on Coach Samson to let us in to some of the products that we can use in the event somebody asks us about neoplasm and says, please, how do we handle this condition? Thank you. Coach Samson, are you there? Hello, Coach?
Yes. Yes. Good evening, sir. Thank you so much for that wonderful knowledge and training and expository on tumor. You know, I discovered something whenever average Nigerians, particularly among we Christians, once they are complaining about a particular issue, and they are asking you, and you are telling them this is the sign of so this is the, they started uh, rejecting, and I would say no, it's not. It's good to reject, but it's not a matter of rejecting of you. It's a sign you need to do something. So exactly the same thing when we mention tumor, particularly to people, they begin to reject and ban and loose. It's good to ban and loose, but ban and loose alone will not ordinarily give you the solution. What you need to do is to take action on how that will not become a serious terminal health challenges to you. So that's the essence of this meeting. So it's not ordinarily meant for only those that are already suffering from this problem, neoplasm, that is a tumor, or somebody that they already detected of any tumor in any part of the body. It can be for women, it can be in the breast, it can be in so many, like a tumor can be in so many areas or the organs of the cells, actually heard from Dr. Egbe. It can be in any part of the body, any organs, tissues of the body. But what's important is that, having discovered that, you don't need to panic. What you need to do is to know how to get rid of it. Treatment and management is the next thing. That is the essence of this meeting, so that we can be aware, we can be informed properly about these challenges. And thank God we have a ecosystem of Superlife that is very effective in the area of prevention. Because I always say, anytime I'm discussing with people, especially on this platform, I said one of the areas why we had a lot of advantage as a Superlife, a distributor or Superlife, ambassador promoting this company on company product is because we know and we're sure we have something the whole world is looking for, particularly in the area of prevention. The medical system, the allopathic or modern medical system, ordinarily does not have prevention, particularly for so many things. Though there are, a lot of changes are being made, a lot of research is going on, particularly concerning some epidemics, diseases, and so many on, to see how they can prevent, people from falling victim of such. And that's why you see vaccine. We always come with vaccine, to really deal with this thing. But unfortunately, there are some diseases, even after using, if you were not so lucky to have taken vaccine and you fall victim of such, some vaccine will not even work after you have been already infected. That is another advantage where our product is needed, because it serves the dual purposes. Even it's even more than dual, but let me just put it at that level. It serves more than the dual purposes of prevention and treatment and management. So, and majorly, like I said, drugs particularly were meant to treat symptoms. So that's why you see when you go to hospital, you go to clinic, and you consult a medical personnel or medical expert, all they are trying to do is to able to conduct a test, or in a case where they could not able to know what exactly the challenges you are passing through after a consultation with medical doctor, they will refer you to a diagnostic center, a lab within the system or outside, in where you can do a medical test to ascertain, to examine your system and able to know the symptoms you emanate. It is what will now bring back the tests to now do and know the right drugs or right treatment to be given to you. So, but in case of our product, you don't have to fall victim of this problem, this neoplasm or the tumor, before you start taking our product. Like I said, prevention, even in the medical world, they said is better than cure. So, and unfortunately, most of these cases are medically does not have cure. So once they become formed, because all the diseases become formed, all the body, the tissues, the cells, the organs become inflamed. Once inflammation has taken place, that means it has become a full-blown disease. And most times, all these chronic diseases, because they form over the time. That is why you see when doctors was explaining, it grows. They malign, that means they spread or they mutate into several parts of the body. And if it's not checked or if it's not controlled, or treated, it will become a serious terminal disease, like it become cancerous. When you say cancerous, it become carcinoma. That's why you say they have some tumor that is not cancerous. That's what was explained to us. So what I was trying to say is that Superlife product is meant for all. All of us that are listening to this seminar or listening to this training today, you need to stand in the place of prevention. You need to take advantage of our Superlife product in the preventive area. That's why we say Superlife, particularly our plant-based stem cell product, is a preventive medicine. Is preventive medicine is also curative and is also regenerative. So at times we prefer to use regenerative so that we will not become a serious loggerhead or with argument between the medical personnel, particularly those in the allopathic and modern medicine. So we use the word regenerative or preventive medicine instead of curative, though stem cell has a lot of features, and one of them is preventive measures. Another one is regenerative. Another one, that regenerative makes it curative. Because what do we mean? When you say regenerative, it shows in the case of you having a tumor and these are spread to several areas, damage your cells or your tissues or your organs. Most times the only solution medically, after giving you so many drugs, antibiotics, and so many other drugs, depending on the level of the challenges, after done the medical examination, most times they resorted to surgery, removing the tissue. Apology for those medical personnel that might be on a Zoom call. When in my class teaching people as a health coach, I always tell them in a layman way to explain, surgery. I said, when drug does not work, remove the tissue. That is the meaning of surgery. Because that's why you see that most times when you have cases, apart from corrective surgery or cesarean section, doctor does not prescribe surgery immediately after discovering or determining a case. They have to, use other means, drugs and so many things before they now, if they are not giving them the required result or the expected result, my result to surgery in the cases that need surgery. So our product is regenerative. Regeneration means that the cells that has been dead due to the tumor or the damage in that cells or tissues or organ, drugs naturally does not or has ability to regenerate cells. So that is where the place of plant-based stem cells like our product comes in as a regenerative medicine. Because what does the plant-based stem cell does? It repair damaged cells. And like you have heard today, the tumor can damage cells, can damage tissues, can damage organs of your body. So as much as they spread, they cause damages in those areas. So our product as a plant-based stem cell product, that's SC30, can repair the damaged cells. So can also not only repair damaged cells, it has ability to also increase your immune system. Because the best way to fight tumor, or either cancerous or no cancerous, is for your immune system to be at par, to increase, so that it can stop the spread of that tumor within your system. Because like the doctor has told us, they have ability to spread, and they spread faster. Let me say this: they grow faster even than the normal cells. They are abnormal growth. They are abnormal cells. Because tumor means abnormal growth in your cells. It can be in any part of your body. So it's abnormal growth. So, and this abnormal growth, because of the way they communicate with the host cells, and they give command to the host cells to mutate, to spread, into other areas of the body. So they tend to be, spread faster or grow faster than the normal cells. So the only way you can stop them is having a product like Superlife SC30, that has a lot of anti-inflammatory properties. Like we said, SC30 is antioxidants, is anti-inflammation, is anti, UV rays, anti, and also, so it can actually help in to stop the spread of those tumors in your system. And the way it does it is that it repairs the damaged cells, increase the number of circulating stem cells. That's very important, because when that tumor brings your body, they spread, they increase in numbers, because they are abnormal growth. And the abnormal growth, if it's not checked, they take over the body, and that's in the case of a malign one, it becomes cancerous. In the place of there's no cancerous, they become a serious challenges in your body. So the best way you can counter them is to have something that can repair damaged cells, the one that only can replicate the new cells or rejuvenate your cells, can activate your dormant cells, and makes, multiply them. That's what we replicate. The new cells grows, and they also regenerate in case of the damage, any of the cells has been dead due to that tumor, that abnormal growth in your body. So SC30 as a product has ability to do that. So it is have a lot of high antioxidant properties. So it can also boost your immune system. Like I said, your immune system is the soldier of your body that has ability to protect you from any kind of damage. Look at it. He said the high level of antioxidant in SC30 helps to neutralize radicals, prevent damage of cells, DNA, and protein. Like I told you, one of the things that the abnormal cells does, that tumor does, is that they give command to your host cell, to your protein, and allows them to spread faster within that can prevent. That's why I said we should major mostly, those of us that are on Zoom call and you are not presently diagnosed with any tumor in your body, please focus more on the area of prevention and your loved ones. So the essence of this is to spread this news and they spread this information for as many as possible. You can help that we have something that can prevent you. Even if you have the case of any tumor or cancer in your family, some people say it is hereditary or genetics, where medically it is back that the cases can be genetics. If you have somebody in your family lineage that have tumor in one time or the other, there is a probability you can also be a victim. So not to be a victim of such, the best thing to do is to take our product SC30 that can prevent you. How? Because when your cell, you look at what you said here, so it neutralizes the free radicals. So these are the free radicals, what it causes oxidations that leads to inflammation. And inflammation is formation of diseases, which this tumor, abnormal growth or abnormal cells can be part of them. So also, it plays a role in helping to prevent chronic diseases, such as cancer. Can you imagine? Prevent. I said tonight, I want to major mostly on prevention. Though we have explained to us that our product has ability to prevent, to optimize, and to regenerate. The regenerations of cells is what we term as curative. In medical world, the word curative is scarcely used, but in the plant-based, in a stem cell world, curative is possible because of regeneration of cells. So what makes curative possible is because cells can be regenerated, and that means a new fresh cell can grow from the body, apart from the one that has been inflamed before, and that means the person can be like a newborn baby, a new fresh person that has not been diagnosed of any problem or that has not been inflamed with any kind of problem before. Look at it, said it can prevent even cancer, chronic diseases such as cancer, cardiovascular diseases, that is talking about any cancer has to do with heart rate, Alzheimer's disease, that is has to do with brain and macular degeneration. We're talking about vision. When you're talking about macular degeneration, you are talking about vision. The different kind of problems can arise from macular degeneration, because our macula is the cells of the eye. The macula and the retina, that is the tissue of the cells of the eye. So it can help even to prevent. We are not talking of people that has already even been inflamed. Now we are talking of those that have not been inflamed, that they can also be prevented. And that is area I want us to talk more and make use of more, because this is what is scarce in the medical world. Because drugs, like I told you, naturally does not really have ability to really prevent, because there's drug you cannot take except you are being diagnosed of a particular, because they are produced or manufactured based on the symptoms. That is the pharmacology of production or manufacturing of drugs. They have to get a sample of the symptoms of that particular disease, and before the drug can be produced to attack it. That's why if you don't have that disease in your body and you take that drug, you are taking a bigger risk because the drug is looking for those elements in the body. That's why. So if you are not having that problem and you are taking that drug, you are exposing yourself to more danger than the person that's even having that engage, because that is the pharmacology of drug manufacturing. So that's why our product is the best bet you can use. Look at this. Overall, SC30 provides blood vessel function in strong UV protection. I'm talking about prevention. So when you say prevention, you mean ultraviolet rays. We call it light-induced death. And every one of us, we are exposed to risk. One of the reasons for this abnormal growth in our system, what we are treating today, neoplasm, which is tumor, can be due to UV rays. Exposures to ultraviolet rays can lead to abnormal growth in any part of the body. So that's another part. So SC30 can prevent it. Then lastly, now it's talking about those that are now already having the challenge. He said eliminating excessive UV radiation will help to strengthen the body immune defense. And like I told you, I say your immunity is the soldier of your body. So what makes you not to fall victim of any chronic diseases is because your immune system is strong. And one of the things that those bad elements, what it does is that they attack your immune system. Now that can lead us to immune diseases. So they attack your immune system because that is the soldier of your body. So that's why our S30 can even help you to boost your immune system. That means you can able to chase out those unwanted, elements in your system, like all those abnormal growth, either Malignant or Benign, whichever one, aplasia, whichever one it is, you can chase them out of the system. So he said, the S30 acts as a super booster of the body, aim to improve your overall well-being. So it is not just particularly for this topic we are treating tonight, it's for the overall well-being, irrespective of any challenges or diseases you might be experiencing. Superlife X30 is capable, to improve your well-being, overall well-being in any areas of your health. So if you're on the Zoom tonight and you have somebody suffering from any other disease apart from what we are discussing tonight, you are welcome. You have seen that the product we are talking about, one of the prescribed products or recommended products for tumor, can handle virtually any kind of chronic diseases, not only one. So this one is just an example, and just for the education purpose. That's why we're choosing a particular topic. So the product, it is multi-dimensional in nature. It can handle various challenges, or let me say virtually any kind of chronic diseases, because it works with your cells. And as we all know that the cell is a basic unit of life. And that's why you see that even the topic we are treating today attack your cells, attack your tissues and your organs, because that is the reason why they are very dangerous. Since how to take the S30, it is taking sublingual because it's a plant-based stem cell product. It does not taking like every other medications or supplementation, or your normal food. It is taking sublingual, that is under the tongue, so that it can have a free direct access to your bloodstream, into your bone marrow, where your cells and tissues emanated from, and from there into all the circulating stem cells in your body. That's why it can do the overall overhauling of your entire system. So that is it. That's about S30. And as you know, it is made from 9 powerful ingredients that it has a lot of medicinal and therapeutic powers or functions in your body. So quickly, let me go to the next product, which is SIC, one of the products prescribed, recommended for treatment of neoplasm or tumor, is SIC. Why SIC? Look at it. Though SIC is a powerful combination or a supplementation of what do you call it, alpha and concise Q10 and 5 other powerful ingredients. But why does SIC very important and powerful to undo the case like this? Because SIC particularly focus mainly on immune boosting, on improving your immune system, or less boosting your immune system, increasing the level of your immunity, like I told you, which is the power of, or the soldier of every human being, your immune system. And then when it comes to a tumor or malignant, either cancerous, whatever, your immunity is the key, is the key factor, is the key factor. One of the reasons why you see medical drugs most times does not really, much effective for cancer or tumor or something of this nature, because they have no much ability to really boost the immune system at the kind of space or level that the cancer cells or the abnormal cells grows. Like I told you, they grow faster. And the drugs does not really have ability to really boost the immune system at that same level. That is why most times they opt for surgery for removal of the abnormal growth in either in the tissues or in the cells of that particular person. So because our product is so powerful and very effective in able to boost your immune system, it can attack that abnormal growth cell because it is highly formulated with a lot of antioxidant properties. And one of them is, like I said, is a powerful blend of afanisomenon, that is blockade, that is alpha, and the constance Q10. Let look at this. I want us to at least tell people whenever I'm talking about SLC, I want you to note this very well. This is the game changer of this product. The formula helps support the natural release. Look at it. Helps support not just release, the natural release. When something is natural, it's nature. So, and the nature is the best. So it helps the nature to function at its best. Natural release of what? Adult stem cell. Though SIC is not a stem cell product, but it has some ingredients like alpha and constance Q10, which some companies are used basically to formulate a plant-based stem cell product. That's only alpha alone. I was listening to one medical scientist, the neurosurgeon, talking about he got a product that is produced with alpha alone, and it is like in a way of plant-based stem cell formulation. So, but Superlife company is using SIC with the combination of alpha and constance Q10, just even as a supplementation. But this, because of the alpha and constance Q10, they have ability to support the natural release of stem cell from the bone marrow and increase the numbers of circulating stem cells, like what I told you the other time. What makes you to able to attack any diseases in your body, either cancerous or not cancerous, either tumor, whatever, is ability for the adult stem cell. Adult stem cell is talking about your own cells as an adult. Your stem cell as an adult, it's called adult stem cell. So, and they are in every part of your body. They have the one for the eye, the one for every tissues of your body. They contain those adult stem cells. And when it helps for the release of them, so what they will do is that when they are released, they will fight any tumor in any areas of your cells or your tissues. You will fight them. Whether where they might be. Once the adult stem cell is released from the bone marrow, and this also will increase the circulating stem cell to every part of the body. So you will fight them wherever they hiding. It will fight them to stupor. And this is the game changer when we have in Superlife. So this SIC is so powerful that it can also even neutralize poison. It can neutralize poison. That's why I learned something from my director. Anytime we eat out, maybe we went for something outside the town or outside, we went to eat at eatery, he will take his SIC immediately after the food, and that will neutralize any food poisoning that might want to occur. So that is how powerful SIC is. Very, very powerful. So that's why for every cancer or any chronic issues, most times we recommend SIC because of the high level of antioxidant properties in that product. Look at what it does. It supports the release of adult stem cells from the bone marrow, helps to improve the symptoms of congestive heart failure, helps to increase the blood oxygen level. Look at it. And they boost energy naturally. They also help to reduce the blood sugar level by reducing the lipid and the glucose level. That's why it is also one of the best products to combine for people that are suffering from cardiovascular health, kidney issues, even diabetes mellitus, or diabetes generally, insipidus, whatever one. So it because it contains a high level of antioxidant properties and a lot of other ingredients that makes SIC very, very powerful, very unique. Contain about 7. We have the vitamin B complex, we have the moringa, we have the chlorophyll, we have the alpha, we have the mixberry, we have the confined, and we have guarana extract. That is why it is so powerful. This product. So look at it. They said alpha also helps to boost immunity health through stimulating the bone marrow to produce small stem cell. Look at the game changer. It will stimulate the bone marrow to produce small stem cell. And when small stem cell is being produced, tumor cells, or that is what abnormal growth cells that we call tumor, that might want to become cancerous, will not be able to withstand a high level production of stem cells in your body. It will chase them out. It will chase them out because the power they have is that they can produce higher than the normal cells. But when the stem cell is being released, from the body, is the mother cells that mother every cell in the body. It has more power. It will chase them out and they won't be able to stay in your body. Very, very percent. Even he said alpha contains anti-inflammatory properties due to the presence of many bioactive substances. Very powerful. I told you that alpha alone, some companies use it as a stem cell product, just only that ingredient. Now imagine Superlife in their wisdom, combining alpha with consanguine, with moringa, with guarana extract, with mixberry, with vitamin B complex, and so on. Combining 7 together instead of 1. That is why it works like magic. It's a boom. So lastly, the last product is SNC, Superlife Neuron Care. Superlife Neuron Care also is the supplementation of a powerful ingredient, which is a concoction, powerful concoction of lutein and zeaxanthin, also with ginkgo biloba, which helps to rejuvenate and revitalize vision and cognitive functions. SNC also helps to neutralize free radicals. This is the area we want to make use for the tumor. Neutralize free radicals, because these free radicals are the unwanted molecules. These are the ones that forms that forms what we call oxidation. This oxidation is the formations of diseases in your body, and then later becomes inflammation. So it can neutralize the formation of free radicals, so that the abnormal growth cells will not be able to develop in your body. It will neutralize them. So in the area of prevention, the SNC is very, very key as well. Like I told you, even if they are informed, it can neutralize them. When in the security ways, they said they have neutralized the robbers or the enemy or the bandits. They said they have been neutralized. Their power is cut off. So SNC can cut off the power of tumor, of abnormal growth in your system. Very, very powerful. And it's also made of 8 ingredients, powerful 8 ingredients. That what makes it potent. That's why you see every product in Superlife, they are game changer. They are powerful on their own, because of the ingredients that were, are present in them. So look at it. Lutein is a powerful antioxidant that detects your body, that defend your body against unstable molecules called free radicals. So they are free radicals, they are unstable molecules. They are stable molecules. It can defend you from them. So that is it. So that is that about all these 3 recommended products to treat or to prevent or to manage, the problem or the diseases condition we are treating to now, which is the abnormal growth or called tumor. So thank you very much for your time. Let me drop the curtain here. Life is super. Hello, sir. Hello.
Hello, thank you,
Yes.
the coach himself. Well done. Yeah, I think we don't. If there is any question in the chat room, if you have any question, please go to the chat room and drop it. Yeah. Of course, the topic is quite well elaborate. So if there is any question, the doc is still available, still in the house. In absence of any question, I want to, while waiting for those who want to drop their question, I want to remind us of tomorrow. Tomorrow is our wealth creation workshop. Wealth creation. We have been on a series. We are laying the principles. Those principles are the pillars for wealth creation. Those of us that have been joining us on Saturday, business meeting, that's purely business meeting. And this principle that is being dished out is principle that can give you result anywhere, anytime. Be it in your village, you have these principles internalized in you, it becomes an aura. Anywhere you are, it attracts opportunity to wherever you are. It attracts opportunity wherever you are. So please, and I can tell you vividly that these principles, those of us, including Dr. Rove, we have been deploying it, and it has been so wonderful. The ones we have covered, we are releasing it anywhere we go. Time might not permit us. That's what I do say. Like each time we are moving out now, please make yourself available, because it's in the field, it's in the marketplace that you can demonstrate. You will see the real impact, or you understand it in a key way. You need to be with us. I'm happy that Samson went with us yesterday and see another level of business. Another business of showcasing what you have in a very shortest possible time, and see how the result is flowing. So even those we that are in under a computer village, all of them are very happy, because they are interfacing with different people that are from different background, from different health challenges. Real time, you are meeting them real time, live and direct. So please, don't just be in your comfort zone, be in your room and be expecting for miracle to happen or magic to happen. Miracle has a process. It's only magic that comes in abracadabra. So humble yourself, come and join us, because this is a new second phase of Superlife, and it promises to be far more bigger, far more greater than the former. Those of us that knows about the former, they have still been celebrating about that past glory, but this latter glory is going to be massive, and you could see the direction we are going, the direction of the captains of the industry, the direction of politicians, governors, commissioners, president, even ministers. These are the people that have a very essential need of this product that Samson have just explained to us. No any other company has been able to come up with what Superlife has. The ecosystem. You need to see where we are discussing with people that are there, authorities, high-rank officers, and they're understanding you. You are speaking the language that they hear concerning their health. And many of them have enrolled themselves with HMO, the ministry that they belong to. Some has even traveled outside the country, and those issues are still there. But with Superlife, life is super. With Superlife, you begin to live a preventive, you begin to be in that level of optimizing your health, raising the bar of your health, so that what others are suffering, you will never suffer it. No matter the pandemic, whether through communicable disease, through water, it will not come near you because you stay above the bar. So I guess let's see if Samson, if there is any question in the chat room. Do we have any question in the chat room, please? Those of us that are in other states, please,
No,
if
sir.
you are eager to know what we are doing, it is duplicatable. We can reach out to you and begin to assist you step by step. You start replicating it over there, and you start seeing the result. Samson, can you find out if there's any question in the chat room?
No questions, sir. No question. The only question is that if somebody asks for record version, we'll send it by next week.
It's okay.
So if there are any two